Keep the good-looking thing going on here, folks. We're going to talk about stress less with sedation dentistry. How about that? Designed to ensure a relaxing visit to the dentist office. So Dr. Stephen Walters and Dr. Samuel Stevens are joining us from Advanced Dental Care Anesthetics. I bet folks get your names mixed up a little bit back and forth.
It does happen occasionally.
Time to time. Especially when you deal with a little sedation here. I was wondering, what is sedation?
Sedation dentistry is general dentistry done while the patient is moderately sedated. So use the term moderate or twilight sedation. So the goal is just to keep patients comfortable and calm while we're doing a variety of procedures, whether it's fillings to root canals to extractions to placing dental implants.
So how do you get them to this place, this sedated area that's like sort of dreamlike, yes?
Yeah, so there's a couple different ways that we can do it, whether it be nitrous oxide laughing gas, a medication you take by mouth, or most commonly we will do IV sedation. So giving the drugs through intravenous routes, that really helps keep people as comfortable and calm as possible.
What kind of procedures do you do following this type of sedation?
Well, we do a wide variety of things. I mean, we do implants, we do surgery, taking teeth out, we can do fillings, root canals, a really wide variety of things. So there's not anything that we can't kind of incorporate into a sedation appointment.
So people learn about this, hear about this. Do you find that once they discover that they can have the dental work done this way, that they are more comfortable approaching it?
I think so. I think they realize that there's a way or a method that they can be comfortable and relaxed and anxiety-free. A lot of people come in, they have a bad gag reflex or they have difficulty getting numb, and so those patients are really great candidates for the type of protocol we use for sedations.
I know a lot of folks are just nervous about going to the dentist because they don't really understand or know what it's like in a modern day setting. I mean, older people, sometimes they let their teeth go because they just remember what it was like when they were a kid. How has dental work changed over the years?
I think the biggest way it's changed from what my experience has been working with an older population is, my goal is to keep patients comfortable first and foremost. I want to get your smile healthy, I want to get your overall health back together, but I'm not going to make you suffer through it to get there.
Yeah.
So sedation is a way to get that way for most people.
Is there an age group or a limit to who you use sedated dentistry with?
So we'll typically sedate patients anywhere from 13 on up, and it again depends on medical conditions and medical history, but we're able to do that.
Because I remember the old stories about the wisdom teeth, right?
Yeah.
You wake up with wisdom teeth and people talk about funny things.
Yeah.
It's a little funny. You have some before and after pictures, I think, some of the procedures you do.
We do.
What are we looking at here?
Well, so this gentleman came in, he was actually sent in by a patient, or actually a family member, and they wanted to have him really improve his smile. Obviously, he was, struggling with a lot of dental disease and
for a lot of years.
For a lot of years, this is something that didn't happen obviously overnight. So we're able to take him through with being sedated, and in one visit, really achieve the result you see on the bottom. One visit. So we can take all the diseased teeth out, place implants, and then on top of the implants, we place a denture that's actually fixed into place and doesn't move.
So this is not a veneer job here. This is a job of removal and that sort of thing.
This is essentially, yes, a removable.
How is this different?
So this is a nice lady that came in, and she didn't like her smile. There was a lot of chipping and wear, and she had a lot of sort of erosion and loss of the enamel or the whiter portion of the tooth. And so with her, these are actually porcelain crowns that were placed on her teeth, and again, these appointments can be very long. To prepare and get the teeth ready for crowns can take anywhere up to 3-4 hours, and so for an appointment like that, for somebody who's anxious, the sedation really does help to get them through the process and get the result they want.
So I imagine some people are a little hesitant if they haven't had dental work for many years to come in and figure out what this is going to do, what's this going to cost, and all that. You can help people with that also?
Yeah, we have our treatment coordinators are great at kind of figuring out the best way to manage the finances and the timing of all the treatment that a patient needs. A lot of times they need a lot of treatment because it's been many, many years since they've seen a dentist, so we have to be able to make it
and we're talking about sedation, making it easy, painless, you don't have to worry about it, you're comfortable, and you come out almost like a new person. And I want to bring up one more thing. I saw the word emergency on here. Like, some folks have a dental emergency and maybe they don't have a dentist. Who do they call? What do they do?
call our office.
Yeah.
We'll help figure it out, whether you need sedation for treatments or just figure out whatever's going on. Give us a call at any time.
Yeah, because sometimes this dental work is a surprise for folks. Like, I should have taken care of this 10 years ago,
Yeah,
but now all of a
yeah.
sudden I can't take it anymore.
It can happen, so we're available to take emergencies as needed.
Okay, advanced dental care and with sedation, which is a great thing. Thank you very much for joining us.
Thank you.